So Cheyenne, another device that you may come across, it's called a PET machine. And so the purpose of a PET machine is to help your mucus clear. So what it does is when you suck on it, it uses negative pressure in order to kind of pull that mucus out towards your airways, your larger airways, so that then you're able to do those big coughs and those huffs and spit out your mucus. So when you use the PET machine, you're gonna make sure that you use very deep breaths. You take a large, steady breath. You're gonna hold it for about 2 to 3 seconds, and then you're gonna make sure that you breathe out for about 4 to 5 seconds directly into the machine like this. One of the other devices that you might come across in your treatment is called a flutter. So the purpose of a flutter is to help people with respiratory conditions to break up all of the secretions that get stuck inside of their chest. So to use that, it basically looks like a little tobacco pipe or something that you would see. And what you're going to do is you're going to take a long, nice, deep breath into it, or like in, and then you're going to exhale slowly, making sure that it's longer than the inhalation was. And then basically what it's going to do is there's a little ball inside that pipe, and when you blow out, it starts to vibrate.
Okay.
So it's going to work to vibrate and loosen up the secretions in your chest. Yeah, so you do that 2 to 3 times, and then you would cough up and do your coughing and huffing the 2 to 3 times, and then you would do so again. Hi Cheyenne, so I understand that you just had surgery, and now we have to help you use incentive spirometry in order to prevent post-op infection. So basically what incentive spirometry does is it helps to circulate the air inside of your lungs so that that stale old air that was in there before and during surgery doesn't stay in there, because that could cause infections like pneumonia. So if you're okay, I'd like to help you do this, and this exercise is done multiple times throughout the day for many days after post-op typically, in order to decrease your chances of getting pneumonia.
Okay.
Excellent. Okay. So perfect. You're already sitting nice and close to the edge of the bed. So what I'm going to have you do is I'm going to have you put your lips around the edge of the mouthpiece there. Perfect. And so now you're going to take a nice, slow, deep inhale into the machine. And basically what's going to happen is the device on the inside would start to raise up. So then you are going to try and hold it up at the yellow marker here, because that's where your physician would like you to in order to have best practice. After about 5 seconds, which is now, you can slowly start to let it fall back down and exhale. That's excellent. Perfect. And so then you would just do that a couple more times, maybe 3 or 4 times, and you would do that 2 to 3 times a day or however long your doctor told you. Awesome. Thank you.